Welcome to Bobale Healthlink Clinics Uganda. Today I'm here with Dr. Bale, the founder of Bobale Healthlink Clinics, which is an online platform. We are here to discuss important health matters. So if you are still new to our channel, please subscribe. Doctor, many patients take medicines, but they don't get better. Why does this happen?
Thank you very much. The number one reason why people take medicines and they don't get better is because many people are doing self-medication. People are doing self-medication, they are prescribing their own drugs. If you are someone, a clinician or a nurse operating a drug shop, someone comes and tells you that you give me Cipro, you give me ampicillin, you give me painkiller, give me this and that. So in the process, they end up using many times medicines that are not treating the actual sicknesses that they are having. So as a result, they will not get well because you are not treating the actual cause of the problem.
Okay.
Even when we say that you are treating the symptoms, you may not even be treating the symptoms well, and you may not be treating the cause of the symptoms. So as a result, when you finish your dose of painkiller, the symptoms come back.
So you have said self-medication is one of the reasons why people are taking medicine but are not getting better?
Exactly.
Could there be any other reason why people keep on taking medicines and are not getting better?
The other reason could be the dose. People could also be taking a dose which is not appropriate. We have had instances where someone has treated the malaria, sometimes even with injections, but then they come back and when you do the microscopy test, they still have malaria parasites in the system.
Okay.
So we also have problems with the dosing, dosing the drugs. So sometimes there's underdosing of the drugs that could make someone not to respond.
When you talk about dosing, there are some people when they take medicines, like someone feels much better and they find them stopping to complete the dose. How does not completing the dose affect recovery?
Not completing the dose of medication is technically underdosing because the medicine is supposed to maybe be taken for 3 days or for 5 days. This person is taking it for 2 days. Once they start seeing some sign of relief, they decide to stop medication. And yet, maybe they're getting better because the drug is in action but has not completely cleared the infection from their system. So once you stop taking the drugs, the bacteria or the parasite again starts multiplying, and within a short time you find yourself in the point where you started.
So you go back afresh and start afresh.
You will have to again do a fresh treatment because you treated maybe malaria, you took only 1 dose and you left. The plasmodium parasites again multiplied after the drug cleared from your system, and malaria has come back. Now the risk with that is that the exposure that the parasite or the infection is getting with the drug can easily create resistance, because the next time the parasites that have survived that drug are coming also with their modifications of their system to fight the drug and to be able to survive in the presence of the drug. So that is how we develop resistance. So we discourage it because in the long run it can create resistance, and we are already battling with the resistance of very many drugs to infections because of that.
Yeah, so you have talked about self-medication and also you have talked about recovery, that when someone does not complete the dose, it brings drug resistance. Like you take the medicine maybe for malaria, maybe this quantum does not work for you because you did not complete the medicine. So since you are the founder of Bobale Healthlink Clinics Uganda, which is an online platform, how does it address these issues of people taking medicines and they are not getting better?
One, we provide the doctors anytime the patients need, so they avoid self-medicating themselves. That in itself is a very big solution, because without this online platform, we actually have no solution to self-medication. Because for you to go to the hospital, you may need to kill a whole day out of work. And just for a minor headache, you may say, this is headache. I will just pass by the pharmacy and pick the drug instead of wasting my whole day going to the hospital to try and look for the doctor. Or going to the clinic, they charge me a high consultation fee. They ask me to do a lot of tests, including irrelevant tests. Instead of me doing all that, let me just pass by and buy medication. So our platform makes it easy for them to see a doctor. They are not worried that they are going to be charged for admission. They are not worried that they are going to be overbilled. We charge a flat consultation fee. Once you have paid it, we are able to attend to you, and there are no other hidden costs that we charge you. So we are making the doctors available so that you get the appropriate dose of the drug, and you also get the drugs prescribed instead of you giving it by yourself.
So which type of doctors do you have, just briefly, in a layman's language?
The platform has all categories of doctors. We have general doctors there that treat most of the things. We have specialists like pediatricians, child health specialists. We have physicians who have studied the internal organs in depth, who can help you. We have mental health experts in the platform. By the way, these professionals are actually hard to get, but in the platform you can easily access them easily. You just pay their consultation fee, and they'll be able to see you whether you're at home or from your office.
So what do I need to see a doctor? What are the things that I need?
The things that you need, we have made it quite simple. We have made it easy that the only thing you need is a smartphone and just data. We know that you're already using this. Most of you already have this smartphone. If you're viewing me, you must be using a smartphone. You already have. That is the biggest gadget we need. And then also, by the mere fact that you're seeing us, you're using data. So you only need a smartphone and data for you to register with our online platform. This is just any other platform, any other mobile app like WhatsApp, Facebook, or X or Twitter. It is similar model, but it is quite protected. When you enter the platform, you are booking the doctor. It is a clinic environment, because the doctor sees you alone, and you also see the doctor alone by yourself. So there is a lot of privacy, and your data is protected. So the only thing you need is your phone and data, and then you register in our website. If you are registered, you can be able to see a doctor in 5 minutes, because you will only log in, book a doctor. There are many doctors we have in the platform online. Book the doctor, pay the consultation fee for that doctor, and then within the next 5-10 minutes, you are able to have your consultation done.
Okay, thank you so much, Dr. Bale. And if you are viewing us and you have not yet subscribed, we ask you to subscribe, because this motivates us to make more content for you. And why don't you sign up today and see a qualified doctor? So see you in our next video. Thank you.